Welcome to Better Health Guy Blogcasts, empowering your better health. And now, here's Scott, your Better Health Guy. The content of this show is for informational purposes only and is not intended to diagnose, treat, or cure any illness or medical condition. Nothing in today's discussion is meant to serve as medical advice or as information to facilitate self-treatment. As always, please discuss any potential health-related decisions with your own personal medical authority.
Hello, everyone, and welcome to episode number 45 of the Better Health Guy blogcast series. Today's guest is Connie Strasheim, and the topic of the show is New Paradigms in Lyme Disease Treatment. Connie Strasheim is a writer, healer, teacher, and speaker well known in the Lyme disease community. Over a 10-year period while working to recover her own health, she authored or co-authored 10 books on Lyme disease, cancer, nutrition, and other illnesses such as chronic fatigue syndrome and environmental illness. She maintains a nationwide prayer conference call group and conducts one-on-one healing prayer sessions. Through her books, her webinars, her blogs, and her interviews, she shares what she's learned on her own health recovery journey. She is the Lyme Disease Editor for ProHealth.com and editor of the Alternative Cancer Research Institute. Her most recent book, New Paradigms in Lyme Disease Treatment, highlights 10 of the top Lyme disease doctors and their approaches to recovering their patients' health. And now, my interview with Connie Strasheim. So I have known Connie Strasheim for probably a decade as we both journeyed through our own Lyme recoveries, and I'm really excited to have her here on the show today. So welcome, Connie.
Thank you, Scott. I'm so honored to just be here today.
Thanks. So tell us a little bit about your own journey with Lyme disease, what your life was like before Lyme, some of the things maybe that you found really helpful in your own recovery, and then how are you doing today?
Yeah, Scott. So I was diagnosed 13 years ago. In fact, 13 years ago this month. And, like a lot of people, I just crashed overnight with a lot of symptoms. I had been working 14-hour days with an airline. I worked for United Airlines. And at that time, I was a flight attendant, but I was traveling a lot for other reasons too. And I just thought that, I'm overworking, I'm tired. But within a few weeks after I, crashed, I started having all these weird symptoms, heart palpitations, my blood pressure dropped upon standing. I lost 20 pounds within 6 weeks. And just began to have a lot of stuff, tremors, heart issues, brain fog, depression, GI issues, you name it. And I saw 13 doctors within a year and finally was diagnosed a year later with Lyme. But it would still be a long time before I would really figure out everything that was happening to me because, you get a diagnosis, you think, okay, I've got some bugs, I'll just knock these out and then I'll be fine. And as you and I know, that doesn't happen. And so I went to see a doctor who gave me 5 antibiotics to start. She just threw 5 different antibiotics at me. It made me so sick. I said, I can't go this route. So I started doing Rife machines therapy, some of the alternative stuff. And I have to say, for the first few years that I had Lyme, not a lot of it really made a whole lot of difference. And I think it was because the doctors that I was seeing didn't address me as a person. They addressed the infections, but they didn't address the healing of my body, the terrain. And that's what, so much of this is that I think we get sick because our terrain is messed up. And so you've got to rebuild the terrain as the foundation, because to me, the bugs are quite often a fruit, not a root of the disease. And, some people will say, no, there's the microbe theory of illness, which is that you get sick because you get bugs. And then other people that say you get sick because your terrain has problems. And that was certainly the case with me. So once I began to address that stuff, I began to feel better. Crucial as part of that, I had to rebuild my body from the damage of Lyme. I had to heal my gut, and my gut is still healing, to be honest. I mean, we all have really screwed up guts because of the environment. I started doing a lot of detox, a lot of heavy metal detox, got my amalgams out, treated the issues in my mouth because the microbes and in the jawbone and stuff can be a really big deal. So just did a lot of things, balanced my hormones, worked on treating adrenal fatigue, thyroid issues, and I achieved some measures of healing. And probably I would say it was really not until 2012 that I began to feel significantly better. And then I was I would say I was pretty functional for quite a while until last year. And then I had a really bad setback last year. I got exposed to some mold, and I also received some PRP injections in my back, and I think I had some kind of autoimmune reaction to that. And so PRP is platelet-rich plasma therapy, and what it is it involves injecting your back with your own platelets, and those platelets stimulate the regrowth of tissue. And I've battled lower back pain for a number of years, and I've done prolotherapy, which is also a regenerative technique, and that was always really helpful. But anyway, PRP did something really weird to my immune system and nervous system. And so last year, I got really severe MS-like symptoms, which I've never had before. It was like, okay, wait a minute, just when I was feeling better than I had felt in a really long time, because my Lyme symptoms were always really more chronic fatigue, like stuff, I never had like the dizziness, disequilibrium, things like that. And that's kind of what I was dealing with last year. And so I was pretty sick from, I'll say, like June through November. And then my doctor had said to me, well, I think this is mold. So, he put me on a mold program, and I started doing some other things. And now I'm kind of back to a place where I'm fairly functional. I'm not back to where I was, but, I'm back to working at home and doing that kind of stuff. But I still have days like if I go off my diet, if I do do something wrong, then I can have a setback. But, and then the other thing is, I had said to you before we got started here, is that it's been a pretty stressful year. It's kind of like, my stress level is kind of at the highest, I don't know, the highest level it's ever been. And so considering that I'm still sitting here talking to you, I think I'm doing pretty well. But anyway.
Yeah, it's so tough. I think stress is a huge issue for most of us. I do think that even when we get to a place that we're doing fairly well, that constantly being good to ourselves around stress and nutrition, I think we both experienced that. To really stay feeling well, we have to do that. And I've actually always wondered about PRP. I think it's a very interesting idea, but I've actually had that question. Well, how do we know that some microbes are not getting reintroduced into the body? Obviously, the initial source of it is our own blood, and so it's not someone else's infections potentially, but it's not clear to me that the immune system then isn't somehow waking up again to the reintroduction of some organism. And I wonder if that's kind of what happened there, but that's when you worked so hard to have a setback like that, it definitely can be discouraging. So I'm glad you're doing better now.
Yeah.
It's good.
Yeah, thanks.
Tell us a little bit about your latest book. So how does something like New Paradigms in Lyme Disease Treatment come together? How do you do such a great job extracting all of the key information from each of these 10 practitioners. I've read it twice myself. I still refer to it as a reference. So how do you do that? Do you interview them and then put it together? Do you have them write pieces of it and then you do follow-on interviews? You do such a great job. I'm curious how that kind of comes together.
Yeah. Well, and as you know, Scott, my first doctor interview book, Insights into Lyme Disease Treatment, I wrote because I felt like people needed better answers from doctors who knew what they were doing, because as you know, that there are a lot of people that treat Lyme and they do it inadequately. And so I wanted to provide real information from doctors that I knew by my experience, by other people's experiences, were doing a good job. And so that was the first thing. But yeah, as far as getting the information from them, it was all through interviews. And honestly, I just thought, what would I want to know for myself to get well, and what are all the components to this? And so I would ask them a question, and then based on their answers, I would ask more questions. And for the most part, I would write it. And then what I would do is I would give them the draft, they would revise it, make any changes, and you just kind of go back and forth like that. And in my first doctor interview book, Susan Mara was one of the doctors there, and she wanted to actually write her own. And so I let her do it, and it was a little challenging that way, but we managed to get it to work. And because every so often you have the doctor say, well, that wasn't quite what I wanted to say. So then, okay, let's do it over. And it can be really challenging for doctors to put all of their information in such a short amount of space, because there's so much more. And so what I really do, one of my gifts is looking for the highlights, looking for the bird's eye view, the big picture, but then also asking the doctors, okay, so these are the different things that you can do to heal Lyme, but what can people do at home? Like, let's say they can't go to one of these doctors. What can you do? Like, what's the starting point? What information can they bring to their doctors that's going to help? And so that's why, in the book, I wanted to provide clinical information, but also tools that people could use at home right now. And so that's why some of the chapters have, like, here's a detox bath you can do. Here are the specific products that you can use for this condition, so that it would be really practical, and people could compare and contrast the different strategies and see the things that all these doctors do in common, and then how they're unique. Because I think all good doctors, there's certain aspects of treatment that they all do. And, like we'll just say supporting the body through the right diet. And then there are areas where they diverge. And so I think it gives people a broad picture of, okay, antibiotics don't work for everybody. Herbs don't work for everyone. But by looking at all this information, I think I can figure out something that resonates with me. And so it was to give, I write the books to give people options. Like, if they do one thing and it doesn't work, well, look, here's another thing that some doctors do to get their patients well. Maybe this is for you. So anyway, that's kind of my mindset.
It's so incredibly information dense that some of the chapters I read, and I was like, oh my gosh, I had to pay to go to 10 different conferences to get that same understanding that's in those 15 or 20 pages from that doctor. So just really fantastic. I appreciate it so much.
Oh, thanks.
So let's maybe take a stroll through the book and cover a few of the highlights. And then certainly if people are resonating with it, I really recommend they get the book, because there's no way we can really even begin to touch the surface of what's actually in it. But let's start then with Wayne Anderson. So in Dr. Anderson's chapter, what kind of stood out for me is something that I've heard him also speak at many conferences in the past, which is this idea of the dominant microbe. And so how, as you're treating something like Bartonella or Babesia, there may be certain symptoms that present. You may start treating a specific organism like Bartonella, and at some point, another organism like Babesia then will kind of come to the surface, and the symptom picture itself can even change, where symptoms you didn't have before are now present. The Bartonella symptoms maybe have resolved because of the treatment, and then something else the immune system is really focused on. And the symptoms that you then experience are those that the immune system has now kind of identified as the dominant microbe. And so that's a really interesting idea. I also like the things that he talked about how he does the challenge protocols or uses specific herbs to kind of provoke to see, is it possible this person may have Bartonella or Babesia? If I give them a certain herb for Babesia and they either get better or worse, then that's information that he can use. And he's such an incredibly sharp guy and pulling, all of this different information together. So what kind of stood out for you in your interactions with Dr. Anderson?
Yeah, Scott, I felt like he's been doing this for so long. He's like one of the original Lyme treatment pioneers. And so I think he's got a real sense for what's going on with people. And so there's always this assumption that if you do a Lyme test, it's going to come out positive. But a lot of times that's not the case. Sometimes people don't have money to do all kinds of tests. And there are organisms that we're infected with that we still don't have tests for. And so what he does is he looks at the whole clinical symptom picture. And I thought that's interesting. So he diagnoses based on symptoms. He'll use some tests, but then he also does what you said is the challenge testing. And he'll use, specific remedies, especially those by Byron White, which have been found to be very specific for each of the Lyme infections. And so he says the Byron White formulas are pretty specific. And so in other words, if you have Babesia and you give somebody a Babesia remedy from Byron White, you'll tend to have an exacerbation of symptoms, which indicates that the pathogen is present. And then he'll use that to create a protocol for the patient. And I really think that, and he doesn't just use Byron White formulas, he'll use other herbal remedies depending on what the patients need, because he's found that, Byron White formulas are pretty strong. And so those might work for some person, but then, like the Sumikamish remedies, she might work for somebody who needs a little bit of a more gentle approach. And so I really think it's a good way to diagnose, when tests are inconclusive or, you just don't even have the finances for that.
Absolutely. Yeah, I've known him for many years, and he's a super smart, intuitive, very methodical in the way he approaches thinking through
Mhm.
things. And so he's got a fantastic brain for teasing these things out.
Yeah.
Let's talk a little bit about Dr. Dietrich Klinghardt,
Yeah.
my primary mentor for 12 years. I actually just got back from another conference of his late last night, and it's just always people ask me why I still go after I've been to so many. I'm like, there's always so many new things.
New things. Yeah.
So he really looks at, I think, several different aspects of illness, but not so much looking at the bug as the cause of someone's symptoms. So I think the main
Hmm.
things, or the main message that he puts out, really is about immune modulation,
Hmm.
about living in health with our microbes, not so much having a
Hmm.
battle or a war with the microbes. The words he used
Hmm.
a lot this weekend were tolerance, and then a word I hadn't really heard him use so much before, but integration. He was saying, how do we integrate our microbes, that it's not
Yeah.
so much a battle. And then his whole system of energetic testing, the autonomic response testing, for me, that was my biggest guide to getting my own health back on track and in a good place.
Awesome.
I still work with practitioners to this day that do autonomic response testing to kind of check in and see what I need to do to continue to refine things. So he's just a absolutely amazing practitioner. I think the breadth of the things that he really looks at, looking at parasites and Lyme and aluminum and pesticides and all of those things, really, they're all important. To your earlier
Yeah.
point about the terrain,
Yeah.
he's definitely a believer in the terrain, and really the microbe is pretty far down the list in terms of the
Mm-hmm.
things that he thinks we
Hmm.
need to focus on, at least from a killing perspective. From an immune
Right.
tolerance perspective, yes, it's important. So what were some of the things that stood out for you in your conversations? I have to think those were fun conversations.
Yeah, it really were. And I really like him as a person. He's incredibly humble, which I think is a hard thing to maintain when you have the kind of prominence and respect that he does. There are not many people that can, I think, live out of such a place of humility when they have so much fame and that kind of thing. But he really has a sense for, I think, a gift, in addition to his training, for knowing what people need. And like you said, it really intrigued me that he talked about the role of toxins and how they set up an environment within the body in which microbes can flourish. And so it's like he says these microbes would not be such an issue if we weren't continually bombarded with aluminum and glyphosate and all this stuff that he says lines the blood vessels of the body. And he says it creates a favorable environment for the microbes. And so when you reduce the body's burden of these toxins, as well as some of the other infections that we don't really think about as belonging to Lyme disease, like the fungal infections, the parasites, like when he has said this many times that when you eliminate parasites, then treatment for the Lyme microbes becomes so much easier. But to be honest, I don't know that many practitioners, even today, who really look at parasites, and I mean parasites outside of Babesia, protozoa, the larger worms and things like that, that we tend to think are a third world phenomenon. But I think they're a big issue for a lot of people, and they harbor the smaller organisms, and he talks about that a lot too. And so if you go after the Lyme microbes and you don't treat the larger things, then when you go after the parasites, then you're still not really getting rid of the Lyme stuff. And so I really appreciate that he looks more at the whole person, not just going after these Lyme bugs. And he, as you know, he has a better strategy now for doing heavy metal detoxification, which is through an ionic foot bath. And so I talk about this in the book a lot, where it used to be that they give DMSA and a lot of other things for heavy metals. And now what he's doing is giving his patients cilantro and then having them do an ionic foot bath. And what that does is the cilantro pulls the heavy metals out of the body. And they've actually done tests to verify that. So, and I've done that on myself. And, I see these black chunks in the water, and, who knows, those could be those metals. So, yeah, I definitely think that he's really in tune with what's happening in the environment. And one more thing I would just mention is that, he's done testing, and these microbes, they're not just we don't just get them through the bite of a tick or a bite of another insect. They're in the, they're in the air, they're in the rainwater. And which makes you kind of go, okay, what are they doing with dumping chemtrails and stuff? But those chemtrails have a lot of toxins in them. And so that's where we're getting aluminum toxicity, glyphosate toxicity. That's where neurodegenerative disease is coming from. So anyway, there's a lot I could say.
Yeah, no, he's amazing. I still enjoy listening to him. And around the parasite topic, the interesting thing is that he's also identified as well that parasites are not entirely bad, but there are some things they do for us, like concentrate heavy metals. And so if we're really heavy metal toxic, one of the reasons the body may allow some of these parasites in is to protect us from heavy metals in a way. And so that's also an important strategy when you're dealing with anti-parasitic therapies, is making sure that you've got the right binders and other things on board to mop up the metals that are going to be released from those parasites that are getting killed by those therapies. The other comment I maybe would make is just for people listening, the cilantro is one that I personally feel like you have to be a little bit cautious about, particularly if you still have metal in your mouth. So make sure that you're working with your doctor on that one. You don't generally want to do cilantro, especially in a tincture form, if you still have any amalgams or any other metal in your mouth. The other thing that's amazing from, Dr. Klinghardt, like 10 years ago, I started working with him as a patient in 2006. Fortunately, haven't needed to work with him as a patient for many years now, but really benefited tremendously. And when he was talking with me about EMFs way back when, no one was really on board with the idea that EMFs were a big issue. I mean, I've slept in a Faraday cage for like 10 years now, and everyone thought that I was, crazy. And now everyone is coming back to talking about EMFs. I see, the people that make the Faraday cages or the silver lined cloth for the bedroom and all that kind of stuff. I mean, they seem to have booming businesses and can't keep the cloth in stock enough to make them and all that kind of stuff. So he's usually one of those people that whatever he's saying today, people will kind of look and kind of think it's a little bit odd. And then 10 years from now, of course, what he was saying was correct. Right. So it's pretty amazing. Just a fantastic practitioner, and as you said, I think a fantastic, really caring and humble person as well. So yeah. Oh, and I was just going to share in the EMF. I think it's so huge because I can tell you, I went through a period of like 3 years where I didn't sleep because of EMFs, and I did everything. I kept moving, thinking, "Oh, this place is going to be fine." But what I figured out is that you have what are called high frequency EMFs and then low frequency EMFs, and you have to kind of address those separately. Because I got a Faraday cage as well, and I have the Swiss Shield. I have kind of like the highest level of protection available. I got it from Europe because I know that, there are different grades and levels. And I mean, any type of Faraday cage is better than nothing. But in reality, they're putting out higher and higher frequencies through the cell phone towers and stuff like that. So you want to get the highest level of protection that you can. So, like you, I've had one for, I don't know, maybe 7 years, and it's always been a really good thing. But I still found that I went through this period where I couldn't sleep, and I thought, well, what is it? And I figured out that, that there are frequencies that come through the wall that from the smart meter. So like smart meters not only emit radiation from the meter itself, but they come through their frequencies that come in through the wall wiring. And so I went out and I got some Graham-Stetzer filters, which you plug into the outlets. And then that, I think, helped to block some of the fields that were coming off through the smart meter. And surprisingly, that really helped me to sleep. I was like, are you kidding me? So yeah, I believe a lot in the EMF remediation. And we have a transformer that from Memon, which is a technology out of Europe. And we put that on the circuit breaker of the house, and it's supposed to help modulate the EMFs in your environment. And then I work with a grounding strap. I still haven't found a good solution for the computer. I don't know that those little gadgets that you put on the computer have been super effective, but, I think we all have to do what we can, because EMFs are such a really big source of illness in that they negatively alter your body's energy field. And when that happens, it creates an environment in which microbes can multiply. Mold reproduces like
so much faster in an environment of high EMFs. And so it's one of those invisible toxins that I really think we have to pay attention to.
Yeah, and my understanding is that the microbes within us also are threatened by these frequencies and EMFs, and thus they then have to respond to protect themselves. And so that also then is more of an issue for us, given that they're inside of us and they're releasing more toxic compounds and things as a way to protect themselves. So yeah, it's definitely important. Let's talk a little bit about Dr. Neil Nathan, another one of my favorites. You have such good people in this book because most of them are already favorites, and then I learned a few new people as well. So he's definitely one of my heroes. He and I, along with Dr. Wayne Anderson, wrote an article in the Townsend Letter a few years ago for the whole mold topic, which has changed a little bit since then, but it's still actually a pretty current assessment of the whole way to approach mold illness. And he often jokes with me because I tend to be a little aggressive sometimes in the way that I implement therapies. And so one of the things that he always reminds me is that if some is good, more is not necessarily better. And it took me, I actually got him a plaque made at one point as a little thank you that said that on there, because it was always something he was reinforcing. And I do have a tendency to kind of overdo things. So I think it's a good reminder that sometimes what the body wants is a nudge rather than a kick. And many times, especially people who have the mentality that we can kill the bugs to get healthy, they often tend to have the kick mentality and not the nudge mentality. And so that's still hard for me, but I've, by getting myself into a bad place many times over the years from being too aggressive with my body, I've kind of learned that nudges are often more readily accepted. So, his work in mold, I think, is one of the really critical things that people need to explore and look at. I'm also really excited that he's been involved in some of the research papers from Dr. Bob Naviau at University of California, San Diego on the whole cell danger response. So he is one of the practitioners, I think, that's always out looking for the next thing that is going to help him have a tool that's going to help his patients. I mean, he really is so aligned with wanting his patients to get well, and someone that I really think has fantastic intention as well. So what kind of stood out for you about Dr. Nathan's work as you guys work together on the chapter?
Yeah. And I just want to just kind of tail on what you said there, Scott, by, the doctors, one of the reasons I chose the doctors that I did for this book wasn't just for their expertise or their wisdom, but also for their heart, because I think that makes a good doctor just as much as what you know. And so, so I absolutely agree with you. I love him. And in fact, I do his mold protocol. And mold, is, most people probably know by now, is a really big factor for a lot of people with Lyme disease. And they're finding that you can't really get over it until, you can't get over Lyme until you get rid of mold. And a lot of us are mold infected because, we have trouble detoxing it. And we've been exposed at some point in our lives. But what really fascinates me about him is, where he's saying you don't have to feel horrible to get better. And that's kind of what you and I think, were indoctrinated into, Scott, when we first got into this, is like, a herx is a good thing. It's a sign that your body's healing, but it's actually a sign that your body's toxic and it's having a hard time getting rid of these toxins that have been generated. And so his approach, he treats really complex patients, really sensitive patients, and he'll start out by giving them small amounts of stuff and building on that. And when I've asked him, like, how can people actually get well with that kind of approach? He says, yeah, absolutely. And he actually has a belief you can be cured of Lyme, and I think that's interesting. He's the first doctor that I had really heard that from. And so I thought, well, okay, you've been doing this for like over 40 years. I mean, not treating Lyme, but, in medicine more than 40 years and integrative medicine over 25. And so, he's kind of been there in the game all along. But one thing he said that I think was really fascinating to me is that nowadays, people are a lot sicker than they were 20 years ago. And so it used to be that you could do one thing for a patient. You could give them a little adrenal hormone, give them an antimicrobial, and they would get better. And now he said, it's like we have to reboot entire systems of the body. We have to, because patients are a lot sicker, there's a lot more going on. And so he talks a lot about his mold protocol in the book, which I don't know if you want me to it's kind of, outline it in 30 seconds, but it's
Sure.
basically, you want to, and some of the other doctors treat mold as well and have a similar approach in that they look at not only eliminating the mold, but the mold toxins, because the mold is an organism, it's a live organism. So you have to get rid of the mold as well as the toxins that they produce. It likes to colonize the gut, the sinuses. And so his approach involves, treating mold in the sinuses with, things like, one of them is a spray, and I'm spacing the name of it right now, to treat Marcons.
Bag spray.
Yeah, that's right. To treat the Marcons, and my memory's not great. I'm still treating the mold, you can tell. It's like, where'd my memory go? So that, colloidal silver, and then ketoconazole, or he'll use different sprays, to go after the mold in the sinuses. In the gut, he'll give something like Sporanox, nystatin. So he uses prescription antifungals because I think he believes those are necessary for the most part. Colloidal silver, things to break up the biofilm, and then binders depending on the type of mold that you have, because not every binder works on every type of mycotoxin. So, you've got cholestyramine that works for one type, you've got bentonite clay, charcoal, and so it really pays to do a test through real-time labs, which in my understanding is still one of the labs that he uses for that, and then also test your home. And so he talks about that, because you want to find out, is your exposure to mold current or was it in the past? And one way you can find out whether it's a current exposure is by testing your home and saying, well, are these, and then comparing it to what's going on in your body, which is what I did. And I was really surprised to find out, well, it's a current exposure, even though we had remediation done, the remediation made it worse. And so anyway, think carefully if about remediating your home if you've got mold.
Yeah, and I think that's actually the first thing people should do, and generally that is the way that he kind of structures it, is to address the environmental exposures first, then to introduce the binders, and then at some point later, that's where he may bring in the more sinus and GI focused antifungal type therapies. And there are two different schools of thought. I think we're familiar with that. There's the Richie Shoemaker approach, which doesn't really have a concept of the colonization potentially of the sinuses and the gut, doesn't really use antifungals, has some different perspectives there. But one of the things that I like about Dr. Nathan is he really is just not tied to any one specific approach, but looking for the things that are working for his patients and doing the best that he can as a skilled and gifted practitioner to help people get their lives back. So I really, he's fantastic. So next in the book, you have Dr. David Minkoff. And I did not realize until I read his chapter that he also talks about using Dr. Klinghart's autonomic response testing. So that was interesting to me. I did not know that. He seemed to focus a lot on the importance of amino acids, of things to really build up the body so that we're not in a catabolic or breaking down state, but what are the raw materials that the body needs to kind of build itself back up and to heal. And it was interesting that he highlighted eggs as being the thing that most closely resembled the body's own amino acid pattern, that is something he views as very healthy, obviously, unless someone is sensitive to them. I know he's got some pharmaceutical grade amino acid products that he utilizes to help people build up the proteins and build up the structural muscles and things in the body as well. So can you maybe tell us a little about that, about his supplements and things that he thinks are critical for people with Lyme?
Yeah. Well, and I think, Scott, it's what I like about him is that he focuses as much on rebuilding the body as going after microbes or detoxing, because I think if your body doesn't have what it needs to function normally, never mind overcome an illness, then it can be hard to get well. And they've actually found that a lot of people with Lyme disease have protein deficiency, which you might not think of that as being an issue because, most of us eat a lot of animal protein. And I mean, I was kind of shocked when I found out I had a protein deficiency. I'm like, I eat animal protein 3 times a day. And so anyway, a lot of that's because of leaky gut and stuff. And so the idea of supplementing with an amino acid product, I think, can be helpful for people that have those issues, because what happens is when you eat animal protein, you have to, the body has to break it down and then reassemble it again into the proteins that it needs to function. And so Dr. Minkoff has looked at the body, determined what it needs and said, okay, so I'm going to create an amino acid formula that will enable people who have Lyme to get what they're not getting out of the diet. And so and that may be an easier way for the body to assimilate some of these nutrients. But his products are also really, he also has food-based products, which I like because, our bodies were not created to just thrive on supplements. I mean, for thousands of years, millennia, we've had food, we haven't had supplements. And so it's like, okay, if you're going to make a supplement, ideally it's food-based. And so he has something called, I think it's the Body Health Complete. And in that, it's kind of like a product that meets a lot of the body's nutritional needs for a majority of his patients anyway. He does testing. He does a lot of testing. That's one thing I like about Dr. Minkoff is he does ART, but he also does a lot of lab tests. He does dark field microscopy. So he does a lot, really, really thorough testing on his patients, and he has done testing to figure out what supplements most of his patients are going to respond well to and what they need based on, the deficiencies. Like there's certain deficiencies that he's found to be common in people with Lyme. Vitamin D, which is something that I think most of us in the United States have been low in anyway, plays a really crucial role in immune function. It acts more like a hormone in the body than a vitamin. And so, in the absence of getting enough sunlight, that's one thing he advocates, as well as the minerals, because our food doesn't have enough minerals anymore. And I know he tailors it to the patient as well, but he's also really good about nutrition. He himself is an athlete. He's runs marathons and things like that. And so he has developed formulations for athletes. And I think he really knows a lot about how to figure out, well, okay, this is what you need. And again, you've got to have the right nutrients and right vitamins to get healed from Lyme or any other chronic condition for that matter. And he does some, he does IV treatments as well. And one of those, did you want me to talk about those too?
No, that's great, because that was actually
Okay.
one of the things I noticed too, was that he talked about IV ozone and silver and phospholipids and all of those things. So yeah, I'm curious what stood out for you around his IV approaches.
Yeah, well, in the IV phospholipid, and I've done IV phosphatidylcholine myself, and I really like it. It really does a lot for my cognition and energy and stuff. But the key to the health of the cell is the cell membrane. And, the cell membranes are made up of fats. They're made up in part of choline. And so by supplementing the body with phosphatidylcholine, you heal the cell membrane. And when you heal the cell membrane, it enables the cell to more effectively detoxify and uptake nutrients. And so it's kind of like the gatekeeper. And so I really like that he does that, because it's a healing therapy, but it's also a detox therapy. And so you have to do it at the right time in treatment. But I personally really like that. And one of the things in Lyme is, people have a lot of cognitive deficits. And so choline can really help to correct those. In fact, one of the things that I do, I take transdermal choline, and I have found that to be a really, really helpful thing to help me function and write and do that sort of stuff. So that's one thing that he does. And then, he gets rid of the microbes through IV ozone and silver. And I think there's some debate about, whether can IV ozone by itself get rid of Lyme. And I think it's better if you can combine it with something like IV silver. I don't really know the answer to that question, but he has pretty good outcomes with his patients. So
fantastic. So next stop is Lyme Stop. So Dr. Tony Smith.
Yeah. Yeah.
So I've met Dr. Smith a couple of times at conferences that I've been at, and I think he's a highly intentioned person as well. Coming back to that theme throughout the book again, I did go when I met him for the second time in April of this year. He had suggested I should come up to his clinic, and so I did go up there in July, and I did go through his Lyme Stop treatments. And so I not quite ready to comment too much on it, other than to say that I definitely had some detox reactions, which were actually a little unexpected. So I'm kind of excited that potentially he's able to get to some layers of things that might still be around that, will help once we're kind of through that phase. There's a fairly long period of weeks to months where people have detox reactions after working with his Lyme Stop. It's kind of getting the immune system to start really clearing these things out. But it was very clear to me that he really cares about his patients. It was clear to me both before I went and while I was there that a number of the people that he works with have had very good results. There's a Facebook group for people that are interested in Lyme Stop as well. And I had kind of read through a lot of that at one point before going as well, and was really surprised with how many people have had very positive shifts in their health after working with him. So what can you tell us about Lyme Stop? What stood out for you?
Yeah. Well, and I've been to see Dr. Tony too. And, I include him in the book, and he kind of said, well, you want to come out and see what I do. And so I just received a treatment when I was out there. I did that, actually right before I had this crash. And I was feeling, and I actually felt really good after I did it. And so I thought, I was like, wow, there is something to this. And I had seen a lot of positive testimonials on the the Lyme Stop board and stuff, and the Facebook page, and it's really a simple thing. It's almost so simple. You go like, how can this work? And but what he's discovered is that when you put fingertip pressure on certain areas of the body, it indicates the presence of infection in the body. So in other words, you can muscle test and find out what infections are in the body by taking your fingertips and touching on different areas of the body. And then when you simultaneously touch, and this is the simplest way I know how to explain it, you simultaneously touch different areas on the brain while touching the location on the body where the bug is. What you're doing is you're sending a signal from the brain to that part of the body. You're sending in a signal for the brain to go after the bug in that particular place in the body. And
there's an aspect of magnets that are involved as well that he often will use as part of that too. Yeah.
Sure. Yeah. And the magnets, he says, are not absolutely necessary, but they amplify the effects of it. So, technically anyone could really learn to do this. And I think he wants to teach many more practitioners how to do it. But he says that, he got the technique for Lyme Stop by divine inspiration. And he had some, there were things that knowledge he had that built on the technique. Like one of the disciplines from which it came is called craniobiotic technique. And so, and that was a diagnostic technique that his name is Versendal. He was a chiropractor, and he figured out that by touching different points on the body, you could figure out what was going on in the body, but he didn't know that it could also be therapeutic. In other words, that technique could also be used to treat. Just the hands-on was enough to basically signal the immune system to go after the infections. And what I like about Lyme Stop is that it's relatively inexpensive compared to most therapies. It's short. Like all things, I think it's not going to fix your terrain, but it can fix the problem of the microbes. And I think Dr. Tony is also learning about a lot of different new bugs that are coming out too. Like he's constantly testing to see, what's going on in people, to find out, because we're constantly being infected with new stuff too, new organisms and things like that. And so he's learning new things consistently. And I call him Dr. Tony because that's what he had him called, but Dr. Smith, just so I don't confuse people. But yeah.
Yeah, no, I think it's a really fascinating technique, and I will comment more on it once I'm a couple months out. I'm actually supposed to go back again and do the follow-up in November, and so I want to get a sense for what he's observed that's different, what I've observed that's different, but I definitely think that it has some potential for people.
Yeah, and just to add to that quickly, I think that they're like all things, it works for some people and not others, and we don't always know why. And I think with Lyme, you got to be careful of saying the herbs are the best way to go, or antibiotics are the best way to go. I lean more away from antibiotics these days because of what they do to the gut and everything. And there's been so much research on the microbiome and how healing the gut is the key to healing the immune system and so many other issues. So and I definitely kind of regret the year and a half I did antibiotics.
Yeah, it's funny. We both had our kind of, separate journeys in getting well. We connected a couple of times along the way. And I think we come to a lot of the same conclusions. Like when you were talking, it's very much the same things that I'm believing in at this point too. So it's really interesting. Hopefully we're both on the right path.
Yeah.
So anything else you wanted to say about Dr. Tony?
No, but just to say about the antibiotics, I don't want to discourage anyone in the sense that if you feel led to do that, or you have a really heavy, fast advancing case of Lyme. I do know that doctors that do natural stuff will say that antibiotics are sometimes appropriate, but I think if you've got a smoldering, slow infection, if it were me doing it all over again, I would do the less invasive, more powerful things like, and one new thing that's coming up these days a lot is our essential oils, which I think provide a nice combination of being both powerful and yet safe for the body. And so anyway.
I agree. I did antibiotics every day for 3.5 years. I would absolutely not do that again now. And at the same time, I've seen people who have tried lots of natural options, and the thing that gave them the biggest boost was an antibiotic. So I'm very open to that as a tool in the toolbox, but it's not the drawer that I open first. And it was interesting because years ago when I first started working with Dr. Dietrich Klinghardt, and he was doing autonomic response testing, and I was going up for the, I want the snake venom and whatever. And he said, oh, now we do Rocephin. And I was like, we do what? What do you, no, we don't do that. And so, there's a place and a time for some of these tools, but in general, I agree with what you're saying. So let's talk a little bit about another one of my favorite people, which is Dr. Raj Patel. I've probably known him for about a decade as well. He's another one of the practitioners that I have tremendous respect for. He's, I think, successful with his patients, not only because of his knowledge around Lyme and co-infections, but also he puts such a significant focus on the whole mold piece. And I think the combination, as you mentioned earlier, is really critical. If you have both of them in play and you're focused on one and not the other, it's going to be really hard. It's going to be an uphill battle. And so trying to find a doctor who understands both Lyme and mold, while there's more and more of them that are kind of getting educated over time, it historically has not been an easy thing to do. So finding one that really understands both, and he's had his own personal experience with both and is doing really well today with all the tools that he's figured out along the way. So for mold, Dr. Patel talks a lot about Richie Shoemaker's work. He looks at things like the HLA-DR testing for the genetic predisposition to biotoxin illness, looks at things like C4A, TGF-beta-1. Back to your comment around testing the environment, he looks at the mycometrics ERMI, or Environmental Relative Moldiness Index, and then really works with patients primarily to make sure that their environment is really optimized for their recovery. That's such an important thing. Where you spend your time needs to be supportive of your healing. And then ultimately, as part of the Shoemaker protocol, you get to the place where you can potentially do VIP. So he does a lot of those things, but then also does the Lyme and co-infection treatment as well as other, microbial things like you talked about earlier. Sometimes people need to look at parasites, or they need to look at fungal issues, or viruses are a big piece of the puzzle oftentimes as well. So he kind of does all of that while at the same time really supporting detoxification and drainage as well, which comes back to the terrain, comes back to minimizing the Herxheimer severity, as you mentioned as well. So I think he's just a fantastic practitioner. I'm really curious what stood out for you during your conversations with Dr. Patel.
Yeah. Well, Scott, he's a guy that has walked through it, having had Lyme himself. And so I think he really speaks from a place of wisdom, but he also looks, and all the doctors really do this, but he talked about it a lot in his chapter, which is healing the whole person. And, we tend to have this idea that disease is about getting infected with a microbe or having too many toxins, but I think disease in the bigger picture represents a lot more. And it's like, what has gone wrong in your life? What has gone wrong in your environment that has caused your body to break down? And so he talks quite a bit about evaluating, why did you get this illness? Did you ever, it's a good question to ask yourself, and what is it trying to teach me? What can I learn from this? Because he's made some observations that people that get chronic disease, I'll say Lyme in particular, they lack a clan or a tribe. That's, Jovet Renaud in Recall Healing talks about that. And so, Dr. Renaud has found that there are specific emotional conflicts that correspond to specific disease conditions. And I've been kind of surprised at how accurate they are, because I've got his Recall Healing book, and I'll look up these things sometimes and I'm like, oh my goodness, you see this. And so Dr. Patel talks about that. And he says people with Lyme, he's found that a lot of them, it's kind of like we lack a clan in some sense. And, that could mean maybe you just don't have friends or family around you. Maybe you've been abandoned, but in some sense, there's a lack of a tribe or a clan. But even more than that, people that get chronic illness tend to be type A personalities. And what goes along with a type A, yeah, I know you and me both. And it's like, it's performance. And when you're in performance mode, you're kind of in fight or flight, kind of rush around. And that suppresses your immune function. And there's been a lot of research on that, on the link between emotions, trauma, your personality. And so he talks about that, about how he had to learn to be less type A and work less and, not be so driven all the time. And so I thought, that's really important. People need to hear that.
I say now that I'm type A minus, and and I think it is true. I mean, clan, tribe, I've heard that. I agree with that. I've also resonate with the idea of many people with Lyme not feeling deserving of health or feeling worthy of wellness. And I think sometimes the type A overachievers, we tend to overachieve as a way to feel value or worthiness. And so we have to kind of find that in another way.
Exactly.
And so it's a challenge, but at least I'm A minus at this point. So
that's good. You're probably doing better than me. So
it's not easy. So next you had Dr. Nicola McFadzean-Ducharme, and she's written several books in the Lyme world as well. Probably the one that people will be most familiar with being the Lyme Diet. That one's been around for a while and still is just a fantastic book. Lyme Brain, I think, was one of her more recent books. I know that she now has an online course as well, where she really goes deep into how she views all of the different issues in Lyme from a doctor's perspective. And I think it's really a fantastic resource for people that want to get really empowered. And coming back to your conversation around essential oils, I think her chapter was the first one in the book that really went into great detail about essential oils as antimicrobials for Lyme. And I certainly did benefit from essential oils. This is years ago. This is back when I was still really more aggressively focused on the microbial issues around Lyme. And I used to make my own custom essential oil capsules based on whatever was muscle testing every Sunday and make them for a week, and had a whole, line of different options. And so I do think that it can be very helpful. And maybe you can tell us a little bit about the antimicrobial strategies that she uses in her practice that you talked about.
Yeah, sure, Scott. And I think it's interesting because practitioners don't usually like to talk much about essential oils because the FDA has really cracked down on them talking about it as a treatment, and especially if they're a distributor of them, which a lot of them are. And so to some extent, it has limited what you might see on a website or something, but they actually have really potent, not only antimicrobial properties, but like herbs, immune modulating. They do a number of different things. And again, I like them because they provide the combination of having the potency of a pharmaceutical, but yet they're safe like an herb. Of course, I wouldn't just take them willy-nilly either because they can be very, very strong. Like I've taken Dr. Klinghart's ozonated Rizzo oils, which are very, very powerful. And I'm a person that can tolerate really high doses of herbs. And, I could take 90 drops of a Nutrimedix remedy. Nothing happens to me. I take 1 drop of an essential oil. Sometimes, I get a reaction. So anyway, but, so she uses essential oils for a number of things, but to also symptomatically treat her patients, like frankincense, is good for headaches, depression, a number of things. She has a lot of herbal formulas, and so she'll use a lot of the herbs that you'll see, Stephen Buhner using, the andrographis, the cat's claw, Japanese knotweed. That's, I think, in her main formula. But she also has different formulations for, depending on what issue you're treating. And there's a whole list of them in the book. But in addition to that, she does LDI, or low dose immunotherapy, which, Dr. Klinghart had talked about that too. And so that's an immune modulation technique that has worked for some people to help shut down an overactive immune system. And because there's a theory that, which but I'm not sure a lot of people in the Lyme community know about, there's a theory that the illness isn't just due to the microbes but to the overreaction of the immune system. And so LDI is it shuts that down, and what it is it's just the antigens or DNA material from 72, I guess. I think it's 72 different microbes. They may have changed it now, but you can take them sublingually. And so it's kind of like a homeopathic. You can take it sublingually or injected. And then what it does is it regulates the immune system, kind of shuts down the exaggerated response. And so, she said at that point when I had interviewed her, she had said that she had mixed responses with it in people. And sometimes it's a matter of getting the dosing right. But, I don't know what you think. It may be something too that works better for some than others.
Mm-hmm. Yeah, and I think it comes back to the whole tolerance or integration that we were talking about earlier. I don't personally think we're ever going to get rid of all of our bugs. We're already 10 times more bug than human cells. And if we look at the conference this last weekend, there was a number that I believe it was that were something like, if you consider the DNA of all of our bugs, that were somewhere around 2% human DNA and like 98%, microbial DNA. I'd have to go back and confirm, but it was a really wow kind of number. So the goal isn't so much to get rid of our bugs, because if we got rid of all the bugs, we also couldn't survive. There's things that a lot of these bugs do for us that is really important. And one of the examples that Dr. Klinghardt shared this last weekend was a group of people that were surviving only on sweet potatoes and lived very healthy into a old age. And what they eventually found was that they had a specific C. diff microbe that was creating all the other things they needed in their body from the sweet potato. And so, sometimes these bugs, they're not so much the enemy. We just need to kind of tame them a bit and be more in harmony or integration with our microbes. So the other thing from her chapter that I thought was interesting was she provided a lot around the importance of detoxification. Yeah. She talked about mold. She talked about metals. She gave a lot of tools that people can implement themselves, like Epsom salt baths and far infrared sauna, doing skin brushing, doing coffee enemas. I mean, for me, coffee enemas saved my life so many times I can't even count, in terms of pain and inflammation and, starting to get a cold or starting to get a flu. And the one thing that would pull me back out of it really quickly. And so anything that stood out on detoxification from your conversations with her?
I think that, she offers really practical things that anyone can do from home. And all of us, whether you have Lyme or not, I think we have to practice detox as a lifestyle. It's got to be something as much as brushing your teeth or, because I used to be kind of annoyed at the idea that I always had to do detox. And I thought, well, this is really just what we have to do to be healthy in today's world. And so she talks about a lot of the things that, like you just pretty much listed them, that we can all do at home and, or in a clinic too. I mean, there's stuff you can do in a clinic and it doesn't have to be expensive. I mean, I got a barely used sunlight and one person sauna for $400 from a chiropractor who just had to move. And, it just like showed up on Craigslist and she goes, so anyway, but yeah, it's something we have to do. And I think taking advantage of all the detox organs, like she talks about that, where, it's like the things she implements are not just things where your liver has to detox. It's like you make use of the kidneys, make use of your skin, your lungs. Deep breathing is a form of detoxification. Right. And so you're not putting the burden on any one organ to do everything.
Absolutely. Yeah. So let's talk then about, and I may mispronounce this, but Dr. Frederick Doze, is that how you pronounce his name? Yep. Mm-hmm. So he's from Germany, from Clinique St. George, which I have talked with a few people over the years that have done hyperthermia in general. I don't know specifically if they were working with that particular clinic or not, but for, dealing with Lyme disease, I have not personally done it other than the minimal type thing you maybe get from doing far infrared sauna, but that's very different than what they're doing with hyperthermia. And then I know they also incorporate sometimes things like ozone, and they have IV laser therapy you mentioned in the book. So what can you tell us about Clinique St. George?
Yeah, Scott, it's really interesting because I met Dr. Doze at a conference here a few years ago, and he began treating Lyme patients by accident. He had 2 cancer patients because his clinic is world renowned for cancer treatment. People fly there from all over the world, and he had 2 women at the same time who went to see him for cancer treatment, but unbeknownst to them, they also had Lyme disease. And so they went to get treatment for cancer and accidentally got healed of Lyme. And so he's been treating Lyme for 13 years with hyperthermia. And what's nice about hyperthermia is that it goes really deep into the tissues, into the joints, where he says other types of treatments don't necessarily reach. And so that's one of its main benefits, is that it goes really, really deep. It's also fast. You don't have to do it for years, like, herbs or something else. And what he found is that when you raise the body's temperature to 107 degrees Fahrenheit, then, microbes can't survive at that temperature. The one organism that doesn't respond so well to it is Babesia, but he said it pretty much will knock out anything else. And of course, then he uses it in conjunction with some of the intravenous treatments as well. And he also does some interesting things that you don't see much of here, like peptide therapy, which is, it's kind of like live cell therapy, and it's a regenerative type therapy. So it's, in some ways, I liken it to stem cells, although, it's not quite that, but because I think regeneration can be an important aspect of healing. So they do that there as well. And the IV laser light treatment that he talks about, it's, I guess the lights have different frequencies that cleanse the blood of different pathogens. It's kind of like something they use as a mop-up technique, but he claims to have really good success. And what I liked about him is I felt he was honest about his statistics, because, I think I've had doctors say, all my patients get better, or 95% of them get better. And I don't know if I believe that that's true. It's just, Lyme is just really challenging and stuff, and not everybody's going to have a perfect, record. So anyway, but he talks about, 60%, he says 60% of his patients get, pretty much completely well. And then another 30% have some improvement. And then there's like 10% that don't benefit. So
the thing that stood out in that chapter as well was he then kind of jumped in also to how key emotional issues are to recovery, and talked about things like neuro-linguistic programming and EMDR. And so, for someone, we talked about that already earlier in the conversation, but for people that believe that the emotional work really is important, I like that when practitioners are open to that and really incorporating that. And I think sometimes, chronic illness is kind of the body's way of saying, hey, don't forget about me. Like you're worried about so many other things, but you need to prioritize yourself. And so I definitely appreciate that aspect of what he shared as well.
Yes.
So,
yeah.
So another one of my favorites, I think they're all my favorites, at least the ones that I had seen before. So Marie Matheson from Canada, she's another doctor that you highlight in the book. And I think many of the things that she talks about in her chapter, I like. There was a lot of very specific information, like for this bug, her favorite things are these, and for Babesia bartonella, her favorite things are these. And so I felt like that's empowering for people. I'm not an advocate of self-treatment, so I think people still want to have a professional that they're working with that are kind of reviewing their ideas, because I think we can quickly go down a wrong path. But being empowered with that information and then have a conversation with your health provider, I think is fantastic. She talks a lot also about diet. So what did you maybe take away in terms of some of the dietary recommendations that she finds helpful in Lyme disease?
Yeah, so she advocates a lot of soups, stews, and broths, which and for certain patients, the GAPS diet, which is a gut healing diet that was developed by a neurologist and medical doctor who's I forget, it was her son or daughter who had autism. And
this is Natasha Campbell McBride, right?
Yeah. And I think that's a diet that can work for a lot of people with Lyme if they don't have histamine issues. Because those kinds of foods can foster the release of histamine. But they're good foods in that they are gut healing because they're constituents in bone broth, in bones and connective tissue that help to rebuild the gut. And there are also meals that are convenient to make. So, a stew, you can sit and make a big crock pot or Instapot of food for the week, and then freeze some of it and then just eat it. Because foods that are slow cooked are easy to digest, and people with Lyme have a lot of digestive issues. And so I think there are a number of benefits to that. And that, so, she's thinking quick food preparation, stuff that's going to heal the gut and be healthy, and then having slow cooked vegetables and meats, which is really a good thing, especially if your hydrochloric acid is low, you don't have enzymes. Those kind of foods can be really beneficial for some people.
Yeah, I think her household probably gets really, really nutritious food. I want to go and have dinner at her house after reading all these great things.
I know. Yeah.
And then she also talked about the role of dental cavitations. And so I would say, Lyme, obviously, probably the most commonly discussed thing in the book. I think mold was a close second in terms of several chapters talking about mold. And then there were a few different practitioners that talked about the role of dental issues and dental cavitation. So I think the kind of key message was that dental issues can hold us back from recovering, and we really need to explore that as well. So anything from your conversations around the dental issues that stand out?
Yeah, I think, Scott, when you first start treating all this stuff, there's an order in which it has to be done. And I think for some people, like Dr. Minkoff, he had talked about the dental issue too. And there was a patient he talked about a cancer patient of his actually, that he couldn't get better because she wouldn't deal with her dental issues. And he had tried really hard to get her well and stuff. And he said, but she just didn't want to, she needed to have teeth removed to get rid of this infection. And she was like, no, she wanted to look nice. And so, but he was saying that was the first thing that had to go, because these infections, they don't stay in the mouth. They become systemic. But I think there are degrees of it too. It's like for some people, the dental issue is a big deal. For other people, it might be 10% of the problem and maybe not the first thing to address. But in any case, I think that all of them believe that it's something you've got to look at, because your mouth is a part of the rest of your body. It's not something separate as we've been trained to believe, like go to the dentist for your teeth and then the doctor for the rest of your body. But the things that go on in your mouth affect the rest of your body, and particularly the root canals and the amalgams. Although if you've had any type of extraction, tooth extraction, could be wisdom teeth extraction, a lot of those are infected as well. And so, but she's her position on it too was that, everyone thinks you got to go have this big invasive dental surgery, and maybe that's not the best idea. Like maybe you can take care of some of the stuff with like ozone injections, or maybe it's not something that the body wants to deal with right now. So, she has seen mixed results with the surgery, the cavitation surgery.
Yeah, I felt like her chapter was one of the broader ones, and that she really kind of touched on all of the key issues. I mean, you could almost take her chapter and create sub chapters and have a whole book just out of her approach. It was really fantastic. And then last but certainly not least, there was Dr. David Jernigan from the Hansa Center, and I've followed his work for many years. I think that he's probably one of the first voices that I heard saying that we don't have to herx to feel better. And 10 years ago when I first read that, I was like, well, that's kind of odd. Well, I mean, I thought we were supposed to have a good Herxheimer reaction, and now I believe completely differently. I also think some of the formulas that he's created with Jernigan nutraceuticals, and those have been around for many years, some of those are really fantastic tools for people. Neuroantitox too is one of the ones that I really like for people that have, brain fog kinds of issues, or maybe they're dealing with ammonia or aldehydes or something to that effect. He also was one of the people, both Dr. Jernigan and Dr. Nathan were people that I had heard talk about Annie Hopper's dynamic neural retraining system, the DNRS, that kind of got me into exploring that a little bit, and ultimately doing a podcast with Annie Hopper as well. And so it's interesting to me that both of them have had good results in some patients with DNRS. And so that kind of comes back to not so much that that's in the emotional realm per se, but it is the limbic system's response to something that maybe at one time was a big threat, and maybe the limbic system needed to respond with a big alarm. But once we've kind of addressed a lot of these things, it comes back to the term you mentioned earlier, which was rebooting, that we need to be able to have some way to reboot the limbic system, so that when now there's maybe a smaller response, you get a small amount of mold or a small amount of something that was a big deal in the past, it doesn't need to respond in the same way and pull down the hurricane windows, and it can respond in a more integrated or tolerant way. And so that's an interesting thing that he talks about as well. So what were some of the things that stood out for you with Dr. Jernigan?
Yeah. So, and just to dovetail on what you're saying about dynamic neural retraining, I think the body the brain, it's like we learn by repetition. And so there are neural pathways that are created based on our experiences in life. And it's like the body gets trained into a system of responding to stimuli in a certain way. And especially, I think, if you were programmed to respond in a manner that's like, I'll just say fear, in a fearful manner to things, what this system can do is reboot your brain so that it doesn't respond in that kind of a fashion. And I think that's one reason why it works, because, if you kind of have this constant fight or flight response turned on, then that's going to affect your cells, and And even though it's an automatic thing, by default, it can affect your thinking. And so one thing about that I like about that program is that it not only reprograms the limbic system, it also retrains you to replace any unhealthy thoughts or behaviors with truthful ones. And, and she does a lot of, they're like visualization exercises and, that help to kind of like put your brain into a better place, because I think a lot of sickness comes from lie-based beliefs, lie-based thinking and behaviors and stuff that was programmed into a lot of us early on in life. And so it's kind of like and your mind is very, very powerful. I mean, we tend to look at emotional healing as like an adjunct to wellness, but for some people, I think it's primary, because I mean, this is the command center right here, and you can tell yourselves what to do by what you think. And it's one of the hardest things to change. It's easier to take a pill, but I don't think health is in a pill for most of us. So anyway, but go ahead.
Yeah. So for some of the other things that stood out in your conversations with Dr. Jernigan and the Hansa Center, what really stood out?
Yeah. So he focuses on the train. That's what I really like about him, is he's saying it's not about getting rid of the microbes. It's about creating a balance of harmony between the microbes and, your body. And so his remedies are not targeted towards eliminating microbes, but toward giving the body frequencies that it needs to self-heal. And his work is based on the premise that the body was designed to heal itself. And so, so he does, so his formulas aren't constructed. Like if you look at his formulas, they're not based on like, well, this herb kills this bug. They're based on a frequency pattern that is going to work with the individual person's body. And he also, in the book, he has a program that people can do at home, which he doesn't really recommend, but if you can't go to his clinic, there are things you can do to working with your own doctor. He lays out a 7-step plan, but he also does some very sophisticated things in his clinics, using software that is essentially designed to reboot the body, to align the energy systems of the body. And he talks about ammonia. You had mentioned that. And ammonia is a really potent neurotoxin that's found in high quantities in certain parts of the body in people with Lyme, like the brain and the heart. And so when people try to do an alkaline diet, he says sometimes they'll get worse because the ammonia, the areas of the body where there's ammonia, they're highly alkaline areas. And so what'll happen is they'll feel worse initially on a diet that's like really high in vegetables, but there's no animal protein. And so he believes an alkalizing diet can be really important at certain stages in the healing process. But if you have high amounts of ammonia, then you want to deal with that first. And Borrelia, and I was kind of surprised because I used to test my pH, and when I really had a high load of Borrelia, I did find that I was alkaline, and I was kind of like, really, it was just a revelation.
And
so that's
parasites can also create ammonia in the body as well as some of the different genetic predispositions that we have. Some people are more prone to ammonia. For me, where I notice the ammonia the most is if you take a far infrared sauna and keep toweling off the sweat and then smell the towel after a good session. Sometimes you can really tell, wow, there's ammonia, and it's coming from you.
Yeah, that's fascinating. Oh my goodness.
So I also liked that he talked about several detox baths, nutritive or supporting baths, and really explanations of how they help us, things that we can integrate into our daily routine that are inexpensive and things that can be really, really helpful. So anything else from your conversation with Dr. Jernigan that you want to comment on?
Yeah, his chapter, like Marie Matheson's and some of the others, has a lot of stuff that you can do at home just to strengthen your body, to detox it. And so I really appreciated that he provided that information, like really in detail. Here's a bath for this. Here's a bath to strengthen and provide nutrition. Here's another one for detox. He's got a liver cleanse in there. So there's a lot of hands-on tools that people can use.
Yeah, it's fantastic. He's another one of the heroes that's been in this for a long time and really has some great tools. So we kind of looked at the highlights of all 10. We actually made it through all 10 of the doctors in the book. And what really stood out to me was that there's a lot of different ways that we can support recovery from Lyme disease, that there's a lot of things we need to look at beyond Lyme disease, the mold, the dental issues, the nutrition, the emotional health. And I just think that the collection of of experts and information that you put together. It's really empowering. We just barely scratched the surface here. Like I said, I mean, I've already read it twice, and I still pick it up and find something new every time. So I think it's a great resource. People can get it. I'll put the link in the show notes. Maybe you can tell us where people can get the book.
Sure. It's ConnieStrasheim.org, and my .com got hijacked, so I'm a .org. So my first name, Connie, last name, Strasheim, and you can also get it at newlymetreatments.com.
And I understand that because some people with Lyme have issues reading, that you have an audiobook of this coming out soon.
Yes.
Is that right?
Yeah. Hopefully by the first week in November. And trust me, I had to interview about 50 people before I found one who could pronounce all the words. I didn't know that was such an issue. But anyway, yeah, we found a guy who's doing a great job. I was going to do it myself, but you wouldn't believe how much work it is to try to record an entire book. So
it's amazing how many different ways people pronounce Borrelia burgdorferi. I've heard it so many different ways. And the minute you hear someone mispronounce it, you immediately kind of say, oh, okay, they probably don't have a lot here to offer. But, so yeah, I know it's tough. So tell us about some of the things that you do on a daily basis in support of your own health.
Yeah.
What are some of the key things?
Sure. I'm kind of taking a big bird's eye view right now in my healing, in that it used to be I just look at like taking some antimicrobials, what supplements do I need to make up for this and that deficiency? And now I'm looking more globally at like, how do I just support my body through lifestyle, through things I'm doing. So as part of that, I've gotten stricter with my diet. I'm looking a lot at the quality of the food I eat, because I found that a lot of things that we thought were healthy, like, free range eggs and poultry and meat and stuff like that, you have to look at the diet of what the animals were fed. And so, because they have found that to be a really big issue. And so I'm following some version of the plant paradox diet, which is a pretty groundbreaking immune system healing diet that's out there now. And so I'm working a lot more on my gut. There's a type of, what is it? It's like a probiotic suppository, the Bravo. That's it. Mm-hmm. Yeah. So I've been experimenting with those, and since we can't do a fecal transplant that easily here, that's one thing. Still doing some treatments for the mold based on Dr. Nathan's approach. I do detox a couple times a week. Try to keep it simple. I just do an ionic foot bath, sauna therapy, coffee enemas, just as part of a regular detox practice. I still take some nutrients. I take bioidentical hormones, and this is my favorite product. I just have to show you this. This is called Memory Works, and this stuff is amazing. It was developed by a doctor that had brain issues, and I really like this stuff because it does three things. It's got carnitine, it's got Krebs cycle precursors, it's got tyrosine, it's got things that basically support energy, mood, and cognition. And so for me, it's been like my staple, the thing that gets me up, gets me going. Just a lot of great stuff for the body. Nice. And so if anyone wants to learn more about that, you can email me at Connie9824@AOL.com. So that's
fantastic.
Yeah.
Yeah, this has been a great conversation. I appreciate you taking the time out of your day to walk us through the highlights of the book. I appreciate that you put all the time into putting the book together. I know it's a tremendous amount of work. People ask me from time to time if I'm ever going to write a book, and I just kind of, at this point, I'm like, it seems a little overwhelming. So we'll see if that happens at some point. But I appreciate you being here, sharing the information. You've been at this a long time. You've tried lots of things. And so sharing your experience with others is certainly very, very helpful. So thank you so much.
Well, thank you, Scott. And thanks for all you do. And you should do a book. Maybe I can help you with one day.
Sounds good. Thanks so much, Connie.
Right.
Talk to you soon.
Yeah, sounds good. Thanks, Scott. Bye-bye.
To learn more about today's guest, visit ConnieStrasheim.org. That's Connie Strasheim, Strasheim.org. ConnieStrasheim.org. I appreciate your support of the Better Health Guy blogcast series. If you'd like to follow me, you can find me on Facebook and Twitter as Better Health Guy. The show can be found on YouTube, iTunes, Google Play, and Stitcher. If you'd like to support the show, please visit betterhealthguy.com/donate. And if you'd like to be added to my newsletter, please visit betterhealthguy.com/newsletters. I'm looking forward to many more shows ahead and appreciate your interest.
Thanks for listening to this Better Health Guy blogcast. with Scott, your better health guy. To check out additional shows and learn more about Scott's personal journey to better health, please visit betterhealthguy.com.